Welcome once again to the refresher course in biomedical content writing. Today we are going to discuss about the components of writing, and we will start with the uh, words, which I already shared in the first session, that there are ingredients. When we start writing, we start with the words, then we create sentences, then we make paragraphs, and we give them structure to those paragraphs to compile the entire piece of writing. So this session is going to be about words, that how the words are going to be used when we are writing for the biomedical or the life sciences subjects. So this session is about, we will discuss three principles and their application to select and remove words from writing biomedical content. So because every word, when you write, every word must carry some meaning to your content. It is never like, as I told in the previous session, that every word must progress the meaning of your content. So you should use the lesser the words you use, and the more the meaning you convey, the better is your writing. So this session will talk about the principles and their application, that how you can select the words, how you can remove the words from your writing to make a better content. So before moving forward, I would just like to you all to go through this principle, which was given by Strunk and Whites. And this is about, this is taken from the book, The Elements of Style, which says, a paragraph should not contain any unnecessary sentence, and a sentence should not contain any unnecessary word. It is not that all the writers shorten their writing, or they avoid any detail, or treats their subject only in outline. But every word has a strong meaning, and most importantly, concise articles fascinate the readers a lot. Means every paragraph should contain as many sentences which convey the complete meaning, and every sentence must have the number of words which conveys the entire meaning without any extra word in it. If every word carries a meaning, that makes your sentence concrete, strong, effective, and clear to the readers. So moving on with this, first let's know that what are the reasons why it is very difficult to distill your message. When we say distill your message, means to remove the content, or to remove the words from your sentences, to remove the sentences from your paragraphs. Why it is difficult? Because first thing is that we are not aware about the principles of biomedical writing, which we are learning through this course. Second thing is that most of the time when we write, we always believe that short messages miss out the important points, which is not like that, because the shorter is the message, the clear is the meaning. Short message does not mean that we are going to remove the content. A short message means we are going to remove the extra words which are not actually adding the meaning, but just adding the bulk to your content. So that is these two principles. If you remember, these are the two reasons. First, we have to leave our belief that the short messages miss out the important points, because even a short message can be strong. Second is, we are not aware of the principles, and in this course we are the several principles we will be learning, and if we can remember and apply those principles, we can make our sentences stronger by using the best words which are required to convey the desired meaning. Now, three general principles of cutting the words. When you write the content, many of the words which you add are of no actual use to the content, or adding no actual meaning to the content. And there are three general principles of cutting those words. First is to remove the words that convey little or nothing. There are certain words which actually gives no major content to the sentence, or major idea to your writing, but they just convey a little of something which is already obvious to the reader. So we have to learn how to remove those words to make our sentences more concrete and more stronger and more effective to the readers. Second is to remove those words that repeat the meaning of the other words. Sometimes we use 2 to 3 words, which actually can be reduced to one word, because we are just repeating the same thing again and again. We will see the examples and we will go through the exercises also in this session. This is just the outline of the principles. Then we will discuss each principle in detail in this session. Third comes the replace a phrase with a word. Sometimes we have the entire phrase which we can convert or which we can replace with a single word, and that is also one of the important principle to remove the words from your writing so that you can make your writing more punchy, more concrete, and more effective to the readers. Now, the first thing is that this is the first principle, that is the remove the words which conveys very little or nothing. Many of the words or the phrases used in the speech have no place in biomedical writing. So it is advised never to use them. Some of the examples are given on this slide. One is, sometimes you write, it is of interest to note that the patient was having so and so problem. It is of interest to note that the following drug has created this side effects. It is interestingly found out by the scientists, or in order to perform this. There is no point of writing these words or these kind of startings with in your sentence, because they don't actually add anything to your sentence's meaning. If you are saying interestingly we have done this, nobody is bothered about why you have done it interestingly. So there is no point of adding such words which have no actual meaning to the reader. Then come due to the fact that you can easily replace it with due to. There is no point of writing the entire due to the fact that. Then comes the disease process, or the cancer process was going on. Cancer was going on. The disease happened. There is no disease process. There is no cancer process. There is no inflammatory process. There is inflammation. There is no aging process. It's the aging. If the aging is happening, the aging process is happening. There is no point of adding the word like process along with these words. So these are some of the words which does not actually convey the meaning, but they are mostly used just to make, just to add the fluff to your content, and without any moving forward the meaning of your content. Then comes remove the double meaning words or the two words which are conveying the same thing. If you see on the slide, the final outcome. Now, outcome is assumed or known to be the final one. Then red in color. You can easily replace it with red. The rose is red in color. It can be better written as the rose is red. So in color is just adding or repeating the meaning which you have already conveyed through the word red. Small in size. Of course, if something is small, definitely you are talking about the size. So there is no point of writing small in size. Then add together. Add means together. So there is no point of writing add together. Entirely complete. Of course, when something is complete, it is entirely complete. So you can just write complete, not entirely complete. Then comes the combined together. When you combine something, you combine it together only. So there is no point of repeating the word combine with together. Then interval of time. If you're talking about time, it means it includes the interval. So there is no point of writing interval of time. You can see the example. The patient's skin rash appeared blue in color. Now, blue in color is unnecessary 3 words we have added in this sentence, where we can easily write the patient's skin rash appeared blue. So reducing 2 words. If you see, the total number of words in this sentence is 8, and out of 8, if you remove 2 words, that means 25% of the content you have reduced. So if every sentence of 8 words is getting reduced by 2 words, you can actually remove around 25% of your content, which will add better meaning and saves the time of the reader. Then comes the interval of time of the experiment was 2 to 4 weeks. You can easily write it as the time of experiment was 2 to 4 weeks. So there is no point of writing the interval of time. Then comes the 3 decibel noise was audible to the ear. Of course, if something is audible, that is audible to your ear only, because that is the only organ that helps you in listening to something. So simply write the 3 decibel noise was audible. So you can see that a very simple principle, but it looks very small that you are just reducing 1 word or 2 words. But when you come to write as a professional and when you submit something for publication, of course, each and every word costs. If you give your article to the newspaper or the magazine, they charge, or they use the words very sparingly because they have the limited space. Then they charge for the space. If you go to the newspaper, they charge for the space. So every word is taking space, and you have to save that space. You have to add better meaning. You have to save the time of the reader. All those things are important when you're writing for the subjects like biomedical or the life sciences, which is very niche and very intellectual subject when it comes to writing. Then comes next. Now see these 2 sentences. It's one more example is just to show you that how if you reduce just the words, how it makes your writing better. If you see the first sentence, both the sentences have the same meaning. The first sentence says, here we measured the weight of the agent drug, dissolved it at a level of 0.5 microgram per liter in saline, and then it was stored at 0 degrees Celsius for a period of 10 days. Now it's a 34 word sentence. If you just see to the second version of the same sentence, it has the same meaning, but the 34 words are now converted into 18 words. So we have reduced it to almost 50%. We weighed the drug dissolved at 0.5 milligram per liter in saline and stored at 0 degrees Celsius for 10 days. If you read out of the 2, the second version is quite comfortable for the reader. It takes lesser time. It gives more clarity. And anybody reading that can repeat that thing and do that thing easily without getting any kind of an ambiguity. Weight of the agent drug, then dissolved it at the level of, you have dissolved it at the level of is unnecessarily we are adding the words. So this kind of a thing you can do when you apply the principle where you are unnecessarily writing 3 words and you can easily convert them into a single word. Then comes replace a phrase with a word. Now see the red colors. In red color, the sentences are given. The first sentence is, we have noticed a decrease in the number of errors. Now, if you see the second version, the better version is, we have noticed fewer errors. We have noticed a decrease in the number of errors can be easily converted into fewer errors. So we have converted 5 words into just 2 words. If you see the number of words in first sentence, we have noticed a decrease in the number of errors. It's 9 words. And if you come to the second version, we have noticed fewer errors. It is just 5 words. So almost 50% we have decreased the number of words in this sentence by just removing a phrase with a single word. Then come to the next sentence, which is, prior to the initiation of the present study, a calibration of instruments was performed. This is very common sentence you will find in when you're talking about the technology or you are calibrating the instruments used in the medical science or the biomedical experimentation. And you can easily convert this sentence also into a shorter version, which says, before we begin our study, we calibrated the instruments. So it is just 9 words, whereas the prior version was around 12 words. So this is how you reduce the number of words in your sentences. You add more meaningful message for your reader. You save the time of the reader, and that is the role of using the correct words and in the correct order. Then these are some of the phrases which can easily be replaced by a single word. For example, it is clear that. You can easily replace that. It is clear that by the word clearly. In the event that, you can easily replace this with word if. At the present time, no need to write at the present time. You can just write now. Due to the fact that can be easily replaced by because. Then comes subsequent to, you can easily write before. And in a careful manner means carefully. You no need to write in a careful manner. You have to just write carefully. Then have an effect on, or you can easily replace this with a single word affect. In order to can be easily replaced by just to. So you can see that 4 words can easily be converted into 1 word, and that's the beauty of a good writer who knows how to save the words and how to save the time of the reader. Then comes the next technique that we use to make your content better, especially when we talk about the biomedical sciences subjects or the life sciences subjects or the medical field. Because in medicine, we always talk in terms of measurement. We are measuring something, whether the doctor is talking about the tumor size, or whether the patient is when the nurse is talking about the temperature, or as an experimenter you are talking about some drug. You're always measuring something. Even if you are measuring the blood pressure of any of your subjects, the blood pressure is high and low has no meaning if you are not adding the concrete thing that how much high and how much low. So unprofessional or poor medical writing or the biomedical writing will have unnecessarily posting adjectives and adverbs. These adjectives and adverbs, which consists of very, many, multiple, numerous, a large number, various. Nobody knows what is very, nobody knows what is many, what is numerous, what is a large number, what is a small number, because large number and small number, they are all subjective things. So you need to understand that when you are writing for sciences, especially biomedical or the life sciences, you should be clear of what do you mean by multiple, what does the very mean, very high mean, or large number mean, or various sorts of, quite a few, long term. Long term is how much long term? As 1 year, 2 year, or 10 years, or a lot, clearly, fairly. All these are not measurable terms. They are mostly vague, which creates kind of ambiguity and confusion for the readers. So being a science writer, you must understand that these adjectives or the adverbs, they have no clear limits, and they are to be avoided when you are writing about the medical science or the life science. Now just see the examples of these kind of sentences where the reader gets misguided. First example is the tumor size became very large. Now for the reader, as a reader, if you're a doctor, you will definitely ask, the tumor became very large. How much large? What is large? Is that tumor? What is the largest size of that tumor, so that I can call my size as large or small compared to something. If you're saying something is large, it must have some kind of a comparison. So you can write that better in terms of the tumor has grown 10 folds. Means when the patient came to you, it was just 2 centimeters, and now it has become 20 centimeters. So you can easily say that it has grown 10 folds. So this kind of a when you add this kind of a precision to your writing becomes more authentic and credible for you. Then comes figure 1, clearly show. Now what does clearly show? Figure 1 shows. Whether it is clearly or not, let the reader read and find out. No need to write figure 1 clearly shows, or figure 1 apparently shows. This kind of a thing adds nothing but just the meaningless words to your writing. So avoid that kind of words when you are writing for the life sciences or the biomedical subjects. Then see the third sentence, which is few patients in our study showed signs of joint pain by the new treatment. Now, signs of joint pain by the new treatment. Few patients. Now, what are these few patients? Whether you have seen 20 patients or 20,000 patients or 1,000 patients. When the person reads this sentence, what he can find out, how much is the extent of joint pain, because few patients can be 2 patients, few patients can be 20 patients, and few patients can be out of 20,000. How much is the few? So if we can write it better and in the measurable way, we can write out of 50 patients treated, 5 displayed joint pain by the new treatment. Now the reader gets the message clearly that the writer is writing about 50 patients, and he's talking about the joint pain which has happened with 5 patients, and then he can evaluate or tell that whether the new treatment has some kind of an effect or the positive effect or not in the area which is explored by your writing. So wherever you can see in all these sentences, all the examples, the main message is, wherever possible, make your writing quantifiable, make your writing understandable, and do not unnecessarily adds adjectives and adverbs, and because they add more of the opinion or your own perception rather than the reader's understanding of what actually is happening. Then comes the problem with the word only. See, only is a very small word if you see, and in English we normally use, everywhere we use this word only. But when it comes to medical writing or the biomedical writing, the use of this word is particularly problematic as it is one of the vague words that has no reference. When you say something is only, then what does that mean and how your reader can interpret this word? Now see the sentence in red. When you write that the findings were positive in only 20 patients, the reader is left to think that 20 patients is not a large number. When you say only 20 patients were having the pain, when you say only 20 patients, it means, is that 20 patients out of 20,000? Or if you are having total of 25 patients and you are writing only 20 patients, it means more than 80, around 80%. So use that word only carefully so that the reader gets actually what the impact of the impact or the effect of that message goes to the reader, because you are writing for a very critical subject and you cannot give the message in a vague way, because your reader is going to make decision based on your writing, and if that decision is not correct, then your writing has failed to do the job which is intended to. So if the doctor understands that only 20 patients is big or small, that is going to make the difference in how he is going to take the further step in the management of his patients. So use this word carefully. If you say only, then tell only from how many, so that the reader can get the clear message and intention behind your writing. Then we talk about the special slang which must be avoided in biomedical writing. Now, just see the example below, which says 2,000 patients were imaged. Of these, 292 had positive cancer. Now, 2,000 patients were imaged. Now, imaged term is a slang in a sense that it does not convey that how that image was taken. What that the X-ray, we are talking about the X-ray image, we are talking about the CT image or ultrasound image or MRI image, what we are doing, because imaged is a kind of a slang used here. So it can be better written as, we studied 2,000 patients with MRI and found 292 had the cancer. And now the sentence makes it clear that the writer wants to say that they have done the MRI for 2,000 patients and they found that only 292, not we cannot say only, that they found 292 were found with cancer. Now this sentence becomes more concrete by just avoiding the slang or the generic words which have no meaning to the reader. Then comes the meta discourse. This term is actually, it is a term from philosophy, which says you are discussing, you are doing the discussion about the discussion rather than instead of directly discussing what you want to discuss. So I know that this may be looking a little confusing, but what I want to convey from this is that sentence or a phrase where a writer just comments upon what is there in this sentence, rather than showing the sentence, he's telling about what is there in the content, then it becomes meta discourse. For example, writer says that to sum up the conclusion, or maybe, or perhaps, or direction of the reader, therefore, however we are going to do this, structure of the text, firstly, secondly, thirdly, finally. So all these things are just, you're not saying what you want to say, but you're saying that you're going to say what you're going to say. So avoid that discussion part and avoid that kind of a meta discourse when you're writing. So sometimes we do topic announcement, like this next chapter points out another problem, or the first observation I would like to make about the subject of diabetes mellitus is, don't no need to say that first observation I would like to make. Just say that I'll be discussing observation of about the subject of diabetes mellitus. There is no need of saying the next chapter points out in this. My next talk is going to talk about this. When you're writing, all these things looks very absurd. When you're talking, it looks fine, but when you write something, no need to add these words. Now, second thing is avoid hedging. What we mean by hedging is, like, it reflects uncertainty or doubt about their research. Because here the word, I would say, it's not only in the research, but whenever you are writing for the medical subject or the biomedical subject or the life sciences subjects, we have to see that we are not creating a kind of a uncertainty or doubt in the reader's mind. And we have to limit the certainty and influence on the reader's judgment. Like most common things while hedging is actually, often, sometimes, virtually, possibly, arguably, perhaps, to certain extent, in some aspects, in most of the things. All these are actually, you're hiding something from the reader, because you are not conveying the certain message. You are not conveying the exact thing which you want to tell to the reader. So may, might, tend, appear, suggest, indicate, we suggest, we indicate, we actually was, we often, sometimes we, sometimes this, these kind of words actually hides the actual intention. If you don't know about something, clearly write that this is what we found and this is what we can commit, but this is what is not available in the literature. So these kind of things must be avoided when you're writing about the biomedical subjects. Then we come to the other redundancies. Redundancies means the things which you can remove from your writing. Like we talk about the tables and figures. Most of the times when you write about the sciences, you do the repetition, you write the same thing in your table and then you put the same thing in your text as well. So avoid that. Never repeat your words, same things in the tables and then the figures and then in the text. And the other thing is repetition in various sections gives very poor impression of the writer. Once you have written one thing in a particular section of your writing, don't repeat the same thing in the other sections. Because if you keep repeating the same things in different sections, the reader will never find it interesting. And it is actually the wastage of time of the reader. You have to focus that give right information at the right place just once. Then comes the, when you put the redundant things or repeat the things, it also dilutes the sincerity of author's work. If you have diligently worked on something, if you have sincerely combined certain piece of knowledge, no need to again and again write the same thing and gives the impression to the reader that you're not sincere about what you're writing. Now, just see to this exercise. This is a very important exercise when we talk about the biomedical writer. These are the two versions I've given for the same sentence. One is written from the lawyer's perspective and the other is written from the biomedical writer's perspective. And for it is just the sentence on taking the consent of the patient or taking the consent of your subject when you're doing some experiment in life sciences. The lawyer, if the lawyer says the same thing, he will say like, the recording of consent may be done by way of signature of a patient or third party who witnessed the informed consent, or by file note of such a third party containing details of the circumstances surrounding the giving of informed consent. So you can just see that how complicated, how convoluted this sentence is, and no reader of no patient or none of your intended audience is going to understand this. Especially we are talking about the complex subjects like medical science. Then comes to a medical professional who writes, record informed consent by a patient himself or via third party who can sign the document as a witness or write a file note in patient file detailing how it was given. So the same message now has been simplified, made much clearer. Whether when your patient reads it, he understands what he is going to do. When your nurse reads that, she will understand what she is going to do. If some doctor or the scientist or the engineer or anybody who will read that from your industry is able to understand what we are talking about when we are saying informed consent. So don't be the lawyer when you are talking to your healthcare or the biomedical audience. Be like a professional medical writer or the biomedical writer, where you convey the message simply, engagingly, persuasively, and effectively to your readers. So at last, it's more words you add, the more ambiguity flourishes. The more you add words, the more the meaning gets convoluted, the more the meaning gets confused, which actually distorts or distracts the reader from your main message. Now, the last message with this section, the last take-home message is that every word counts and consumes readers' time and the writer's efforts. So use each word judiciously, and so that your readers will be happy with your writing. And as a writer, you'll feel more confident and more clear while delivering your thoughts in your writing. Thank you so much. This is the part one of this session, and with this we complete everything about the words when we talk about how to choose or the select words while preparing the content for the biomedical subjects. Thank you.